Hello Ghana, this is Fruits of the Womb, your preferred maternal and child health TV show. My name is Dr. Vera Bayu. The journey of pregnancy usually takes about 9 months and is expected to end in a healthy mother and healthy baby. Unfortunately, this journey is wrought with a lot of challenges for some women, unfortunately leading to death. Today on Fruits of the Womb, we discuss a very important topic, dying to give life, with emphasis on hypertension in pregnancy, which is one of the leading causes of maternal death in Ghana. We'll go on a quick break. When we come back, I'll introduce my guest.
Your presence has changed my life. Your tenderness makes me want to take care of you forever.
And I promise that I will give you nothing but the best always.
Cousin's Baby with natural ingredients also gives the best care for baby's soft skin and hair. Cousin's Baby, growing together naturally. From your first shopping list to the very first sound you made, to your first bar, your first date. You've brought me so much joy, and I promise to always protect you. Camel Baby Antiseptic with a mild formula protects your baby's delicate skin from germs and bacteria.
So welcome back. This is Fruits of the Womb, brought to you by kind courtesy of Cousin's Baby and Camel Baby Antiseptic. Let's stay interactive. Join us on our Facebook page. Go to Facebook, type Fruits of the Womb and post your questions, comments, and contributions. We're also live streaming on Facebook, and if you've missed any of our episodes, you can go to YouTube and type Fruits of the Womb TV show, and you can watch all our previous episodes and today's episode as well. Today on Fruits of the Womb, we discuss dying to give life, with special emphasis on hypertension in pregnancy. To help us delve into this topic are two familiar faces. See, on my extreme right, we have Dr. Titus Bayu, an obstetrician gynecologist with the Kolebu Teaching Hospital. And on my immediate right, Dr. James Wachi, an obstetrician gynecologist. The last time you told me to say OBGYN. Yes. At the Lekma Hospital. You're welcome, gentlemen.
Thank you.
Briefly, what are the common causes of maternal deaths in Ghana, and how big a problem is hypertension in particular in our setting? Dr. Bayu.
All right, thank you very much, and thank you for having us on your show again. So maternal death is very sad. We don't want to see it. Nobody wants to hear about it. Nobody wants to see it at all. We wish it never happened. So unfortunately, sometimes it does happen. And it's a significant problem for us, for the whole family, for the whole community. It's such a terrible loss if it happens, because nobody plans that you are just going to trying to give birth to another human being, and in the process lose your life. But be that as it may, the common causes in our environment are hemorrhage of all forms, that is bleeding. Bleeding before, bleeding during the process of giving birth, and bleeding after. One of the common causes of maternal death. Next to that is hypertensive disorders. And in fact, in the teaching hospitals, hypertension is now the leading cause
of maternal
death. But nationwide, is still bleeding. Then we have other causes such as obstructed labor. We also have women dying from infections. We have women dying from abortion and its complications and other related causes. We also have some indirect causes of maternal death, such as some medical conditions that get worse during pregnancy and may result in death. Common among them is sickle cell disease and other factors that may result in death. So these are briefly the common ones that we encounter as leading to us losing our mothers.
Dr. Boachi, at your facility, do you encounter a lot of pregnant women who have hypertensive disorders? Yes. And how big of a problem is it?
I was just going to say that it's not just in the teaching hospitals, because in my facility, which is a district hospital, hypertension is one of the leading causes of admission that we have. If you go to the ward, about maybe more than 50% of the cases that we admitted, obstetric cases, are hypertensive problems. And then there's something that we say about during the rainy season. I mean, we haven't researched much into it,
yeah,
but it's known. It's a fact. It's a fact that during the rainy season we have a lot of hypertension disorders in pregnancy presenting. So it's a very big problem. And the thing with it is that if you don't, somebody say catch it or diagnose it early and start treatment, it can be very, very fatal. But if you find it and you manage it, most women would go through, and they shouldn't die from hypertension in pregnancy.
We'll answer how the diagnosis is made and symptoms and signs. But before that, what are, or should I say, risk factors, or if there's any identifiable cause of hypertension during pregnancy?
So you have people who are hypertensive already
before they got
pregnant.
Okay.
So we know that they're hypertensive and they get pregnant. That's a chronic hypertension, and they also become pregnant. And then people who are not hypertensive, but by virtue of being pregnant, they become hypertensive. That's what I call a PIH, pregnancy-induced hypertension. And then the risk factors that we have, multiple pregnancy. The pathophysiology, and when I say the pathophysiology, the basis of the disease is mainly because the placenta is attached to the womb. So if the placenta is not there, you wouldn't have pregnancy-induced hypertension. So one of the risk factors, to make sense, is twin gestation. Because when you have a twin gestation, the placenta surface has a wider surface area. So they are at risk of having hypertension in pregnancy. And somebody who has had it before in a previous pregnancy, you're also at risk of having it again. And there are other conditions, maybe thyroid disease, medical conditions that one may have that may predispose them to having hypertension in pregnancy. And there are some forms of pregnancy disorders, molar pregnant, not necessarily pregnant, but they also are predisposed to getting hypertension in pregnancy. And the good old stress that we talk about, no problem, but I mean stress also. So you are stressed, normal person, hypertension, stress. In pregnant woman also, stress can also cause you to get hypertension in pregnancy. So basically these are the few ones.
And maybe I'll just add a little more, that age. It's also a very early age in pregnancies, and maybe you are 16, 15 and you get pregnant, your risk of getting it is higher.
It's high.
And then also a very advanced age. If your first pregnancy, you are 40, your risk is also high.
So extremes of age.
Extremes of age. And then prematernity, especially if it's less than...
When you say preemie, I'm sure my...
yes, I'll explain that. So pregnancy with a new husband or for a first-time husband, that you have been lived together for more than 6 months, your risk is a bit higher.
I see.
Yeah, but if you've been with a husband or that partner for a long time, the risk is virtually ruled out. But if your first, maybe you are newly married or you've remarried or with a new partner, then there's a slightly increased risk. I think those are the ones I'll just add to what Dr. Boakye has mentioned.
So viewers, I must say that these are risk factors. It doesn't mean that if you have a certain risk factor, by all means, you will develop hypertension in pregnancy. But they just mean that your chances are higher than someone who doesn't have these factors.
That's right.
Yes. So what are some of the signs? Are there any signs that a pregnant woman will exhibit that give an indication that she has hypertension?
Hypertension, even in the general population, is known as a silent killer. It doesn't give you signs. So by the time you see signs, it's really bad.
It's advanced.
Yes. So instead of waiting for the signs or symptoms of it, please have your blood pressure checked anytime you are pregnant. When you attend antenatal care regularly and they check it, then maybe the earliest sign may be a rise in your blood pressure. But the symptoms that you as a patient would know that I'm having hypertension, there are things we really don't want them to happen. But some of the things may be headache, they may have blurred vision, then they may have swelling of the feet, Now, swelling of the feet is quite common in pregnant
I
women.
was going to say that because
Yes.
once you say that, then you frighten a lot
Yes,
of
it's
people.
quite common in pregnant women, but when you have it in association with raised blood pressure. And then something else in your urine, which you call protein, then it's not really a very good sign.
Okay.
But swelling of the feet is quite common, but it's one of the signs that may also occur in hypertension in pregnancy. And most of the signs and symptoms occur when the condition is complicated. If it's not complicated, you wouldn't have them. So, but if it's complicated, in addition to all of this, some people may have nausea and vomiting, then they may have pain in the epigastrium. That's the upper part of the abdomen, or towards the right side of the abdomen. So these are some of the signs and symptoms. And the worst of it is that they can actually convulse. Okay. They can convulse, they can get a fit. And we don't want anybody to get to that level.
That level.
Yeah.
What is preeclampsia, Dr. Boachi?
It's just like Titus said, that's what they put in. So you can have your blood pressure raised and there's no protein in the urine. But if your blood pressure is raised and we test your urine for protein and it's positive, then you have preeclampsia. And it's usually done at every antenatal visit. You check your blood pressure and then you check your urine. That's the reason why we do that. Because you are moving into another realm. That's what it said. We don't want you to get there. So, and usually in the second half of pregnancy, that's when the preeclampsia starts. So the blood pressure increases, and then there's protein in the urine, and there are degrees of the preeclampsia. You may have we just say we grade the protein maybe +1, +2, +3, and then together with the so we have mild, moderate, and then severe. And then as you progress up, you get to the eclampsia. That's when you fit. Then you're not in the pre-eclampsia. So pre-eclampsia means before eclampsia. And we don't want you to get to the eclampsia. So we don't even want you to get to the before you get to the eclampsia. Because then you start having all the symptoms. You talk about the epigastric pain, the blurred vision, and you fit. And then it can get really bad. It can get really bad. So we don't want you to get there. That's why we advise that once the BPs are checked and the urine proteins are also checked, and the slight sign we see that the blood pressure is increased, then we put you on medication to keep them at bay so that you don't progress to the preeclampsia and then the eclampsia. And I must say that it's a progressive disease. Yes. Once it starts, it moves forward unless the pregnancy is terminated. So there are certain conditions, certain times that, we look at the woman, she's just 20 weeks. And we look at the way things are going. If we want to maintain or keep her to 40, we might lose the mother. So then we decided, no, we need to terminate this pregnancy. Let's start afresh. And now we know that this can happen, and we start battling it from the beginning. But
so
if you want,
it can be that bad.
It can be that bad.
You have to terminate the pregnancy even before baby is due.
Sometimes people are lucky, maybe around 28 or 30 weeks, then we give certain things to mature the land. So luckily you may get a life child. But sometimes at 20, you need to get it out, and then you go home without a baby because you want to save the mother's life.
And that eclampsia, once it happens, it doesn't matter the gestational age. The pregnancy has to end. It has to end at that point.
So viewers, once again, we've observed another reason why you need to have your urine checked at every antenatal visit. We talked about it during our episode on diabetes in pregnancy, and we're talking about it again today. You need to have your urine checked at every visit. How is the diagnosis made? We've mentioned this briefly, but once again, Dr. Bayu.
So basically, the diagnosis is made by checking your blood pressure, and that simple tool or equipment saves lives.
Which is available at every health center.
Every level of care. Just putting the sphic there and checking the blood pressure is what is needed, and then the urine. And the blood pressure, when it's checked, when you are relaxed and rested, you've arrived in the facility, waited for like some 15 minutes, and they check the blood pressure and record it. And usually it depends on what you begin with, but by and large, anybody whose blood pressure is more than 140/90, it's hypertension. And then if we should pick up protein in your urine, then we make the diagnosis of preeclampsia as well. Yeah, so that's basically it.
We've talked about headache, abdominal pain, but so far it doesn't seem like such a dangerous condition. When does it get dangerous, and how does it lead to death? Because I don't understand why, and I'm sure my viewers also wonder, why it's killing a lot of our women. Because you said that the diagnosis is easy to make, and there's treatment available. So why is it causing death?
See, the complications is what I'm afraid of and what Titus is afraid of. Because when I have my house officer or my medical consultant, the woman has fitted, then I have to drop everything I'm doing and start running towards where they are. Because when you fit, then you can even, because the blood pressure also goes up, you can get a stroke from that. And then it doesn't even end there. After you've gotten the eclampsia, you fitted, there's a place we call HELP syndrome.
Yeah.
And
Help.
But
Okay.
not the
Not
word
no help.
It's a mnemonic,
Okay.
which stands for a very terrible state of the condition. Let's put it that way.
There's hemolysis.
Yeah, you fail to clot. You know,
You
you may
be
just be
bleeding
bleeding
from everywhere.
and you will not clot. Your blood cannot clot.
Do you understand? And then your platelets, those are the
cells
cells that
that help
help
the
clot.
body, yes.
It becomes very low, so you are not clotting. And then you are bleeding from every place, so into
Everywhere.
your brain and from the liver, everything.
Your kidneys can shut
Your
down.
kidneys shut. No, that
immediately.
they actually
They will
shut down.
You know.
So
And then you
it's
can get edema in your lungs, pulmonary edema.
When you say pulmonary edema, I'm sure people are wondering
Yes,
what is
so
pulmonary
your
edema.
lungs are supposed to contain air. That's where you breathe, but they can get flooded with fluid. And then you are drowning in your own fluid within you, you know, and it is terrible. You can have fluid around your brain, so a form of cerebral edema. And all that is terrible, you know, so we don't want anywhere to get it.
These complications definitely don't happen to all women with pregnancy-induced hypertension. So we'll go on a quick break, but when we come back, you tell us what can be done for a woman who is diagnosed with hypertension during her pregnancy. Viewers, stay tuned. We'll be right back.
Your presence has changed my life.
Your tenderness makes me want to take care of you forever.
And I promise that I will give you nothing but the best always.
Cousin's Baby with natural ingredients also gives the best care for baby's soft skin and hair. Cousin's Baby, growing together naturally.
From your first shopping list to the very first sound you made, to your first bar, your first date. You've brought me so much joy, and I promise to always protect you. Camel Baby Antiseptic with a mild formula protects your baby's delicate skin from germs and bacteria.
So welcome back. This is Fruits of the Womb, brought to you by kind courtesy of Cousin's Baby and Camel Baby Antiseptic. Let's stay interactive. Join us on our Facebook page. Go to Facebook, type Fruits of the Womb and post your questions, comments, and contributions. We've been looking at hypertension in pregnancy. Before we talk about treatment, is there anything that can happen to the baby? Are there any complications to the baby? You mentioned that sometimes you have to terminate the pregnancy altogether. But apart from that, what else can happen to the baby?
So, I mean, so prematurity is a problem because then the baby, the mother is at 30 weeks or 34 weeks, not actually 40 weeks that we say the pregnancy has gone to the expected date of delivery, and you have to deliver them early because the mother's life is at risk. So the prematurity, and then there are complications that have something we call abruptio placenta. That means that the placenta usually comes off after the baby has been delivered. But in this case, the placenta comes off whilst the baby is still in the womb. So when it happens that there's no perfusion, so if you don't...
Perfusion is such a big thing.
The baby is not getting any blood nourishment from the mother.
Okay.
So if the woman abrupts, like the placenta separates, and you don't diagnose it early, she doesn't come to the hospital early, then the baby dies before she even gets to hospital. And then if the baby doesn't even die, and then you're able to get them out, they may suffer from what's called asphyxia, and because it's separated, they've been without oxygen for some time. So they may even develop brain damage at a point. So it's both dangerous to the mother and then to the fetus as well.
So Dr. Bayo, what treatment options are available to women diagnosed with hypertension in the course of their pregnancy?
Okay, so as terrifying as the condition looks, and as we've described, it's manageable and can be treated fairly well. And the treatment will be based on the time that we make the diagnosis and what diagnosis is actually made. If it's just an isolated hypertension, there's no preeclampsia, just simple antihypertensives will be fine. And you can carry the pregnancy still to term and be delivered normally. However, if it's a preeclampsia, the disease gets worse.
Preeclampsia meaning that this time there's urine,
there's protein
in the urine as
yes.
well.
So the disease can get worse. So if it is mild preeclampsia, we can still manage to a good time and then deliver. But if it's severe preeclampsia or eclampsia, it may cause us to end the pregnancy at the time that we are making that diagnosis. And I want to use this platform to appeal to would-be parents, because sometimes the decision is made that we need to end the pregnancy and it is difficult for the mother to agree or for the father to agree because they don't understand what is actually happening. But the disease can get worse and it can be rapidly fatal. You can quickly die from it based on all that we've explained. As Dr. Boachi explained, the disease is occurring as a result of the placenta being there. So if you are delivered and the placenta is removed, then we have treatment or cure for the condition. That is when we can have a cure. Until then, everything we are doing is managing it just to give the baby a good chance. But when we realize that your life is at risk, then we have to end it. So at some point, the treatment ends with delivery or ending of that pregnancy.
Is it possible for a woman throughout the course of her pregnancy was fine, blood pressure is normal, and then after delivery develops high blood pressure?
That's why it's important that when they deliver, you have to come for the 1 week visit after the some people say 2 weeks, 1 week after the, because we need to check all these things and make sure that the BP is controlled, because it happens often. We see them and they come and then the BP is skyrocketing. Sometimes they even warrant admission. We need to admit them and manage them and prevent them from getting into preeclampsia, eclampsia. You're not supposed to, it doesn't work, but they also can after delivery can have that. So it's very, very possible. So that's why when you finish, you deliver, we don't just go and then don't come back. You come back, we see you at least twice before we see that, okay, everything is fine now and you can go. So it's very possible.
And is it possible that a woman with hypertension can go through the pregnancy, take her medications and not develop any complications at all?
Yes.
Is that a possibility?
It is actually the majority of the case, the situation. That is the norm. If you are diagnosed early, you are on treatment, that is our expectation, that you go through safely without any challenge at all and then deliver. But it is when the diagnosis is not made early or you are not compliant with medications or something else, that's when these complications come. So we actually do not want to see the complications. If it's diagnosed early, you can go through perfectly well. And let's add that in majority of the situation, when it is the pregnancy-induced one, after delivery, it resolves and you are fine. You don't have blood pressure, high blood pressure again. However, in a few women, it may persist and then you are now hypertensive for life and you have to be on medication.
And it's possible those women even had the hypertension before the pregnancy but were not aware of it. So viewers, like you know, every week we have the question of the week, and if you get the answer right, you get a prize from our sponsors. So for this week, the question is, send your answer to the number on the screen. Let's check out last week's winner. Congratulations. And as usual, time runs so fast. Dr. Boachi and Dr. Bayo, your final words to advise our viewers. Because it seems from all our discussions here, it seems as if hypertension in pregnancy is something that is easily manageable, is easily diagnosed and can be easily managed. But our women are still dying. To think that it's the second leading cause of death in our part of the world. And as you said, in teaching hospitals, it's almost overtaking bleeding in pregnancy. I think our viewers need some final words of advice. So who will go first?
I think my senior brother should go first.
What I would want to see at this juncture is that, as you said, the diagnosis is by checking your blood pressure. So when we are pregnant, let's not sit in the house and wait, give all sorts of excuses and not come for antenatal, because that's what we see a lot of kids. They don't come for antenatal and they present to you fitting. So let's go to the hospital and then let's get our blood pressures checked. And I also say that when we come to the hospital, we say see us in 4 weeks' time, but you are in the house and you have symptoms or you don't feel well, don't say that the doctor said or the midwife said I should come in 4 weeks, so you are waiting for the 4 weeks. No. Come and let's check and make sure that everything is fine. When you come and we find out that there's a problem, then in the initial stages, as early as we find it, we can manage it and everything usually goes well. So let's not sit in the house. Let's get our blood pressures checked. Let's go for antenatal visits. If we have problems in between our visits, let's contact our healthcare providers and then we'll be sorted out accordingly.
Thank you, Dr. Bachi. Dr. Bayu.
So yeah, I think just as James said, antenatal care. It's been proven by research that antenatal care can prevent these conditions. It can prevent women from dying from hypertensive disorders. So as long as we would attend antenatal care, it will help. And sometimes the woman wants to, especially those who have delivered before, they want to stay at home till the pregnancy is 7
Almost
months.
due.
Yes, and some people want to hide it. Please, no witch is going to eat up your baby just because you've come to antenatal clinic. It's rather you may die from a complication, and it's not from witchcraft. It's just because you did not attend antenatal care. So let's come out boldly. Let's come out to the clinics and then seek help. And now advise lower cadre of staff, the CHIPS centers, the maternity homes and stuff. If you record a high blood pressure, please let the woman get to the next level where they can get good care. Don't give the person who has high blood pressure and is pregnant paracetamol to go home, that it's to take care of it, because that's happening a lot. Somebody's blood pressure is high, they come with headache and they say take paracetamol and go and come next week. No, send that woman to the next level. And I'm sure when we all do this, our mothers will survive. And
when you are giving the referral, please go. It's uncomfortable, you may be scared because you're going to a bigger center, but it's for your own good. It's because your life is precious. So viewers, this has been Fruits of the Womb. We've looked at hypertension in pregnancy, and I'm sure you've learned a lot. Remember that hypertension is a leading cause of maternal death in Ghana, and it's very important to have your blood pressure and urine checked at every antenatal visit. If diagnosed with hypertension, ensure that you comply with all medications prescribed and keep to your appointments. So thank you, viewers. I hope you've enjoyed today's episode. Remember that if you missed any episode of ours, you can go to our YouTube page. Go to YouTube, type Fruits of the Womb Show, and you can have access to all our episodes. I hope to see you same time next week. My name is Dr. Vera Bayo. God loves you. Stay blessed.